also talking about Ebola, but now here in the Bay Area, we're talking about Enterovirus 68, again affecting mostly children nationwide, and now the first case right here in Florida, specifically the Bay Area, as I was saying. We're joined now from the Hillsborough County Health Department, Amanda Pullman. She's an epidemiologist and can give us a little bit more information on this. First and foremost, what do parents need to know? Because I'm certain a lot of people are saying, what do I do right now? What do I need to know about my kids?
What's most important right now is just to remember we're just coming up upon flu season and just respiratory illness time of year, where we would expect to see the usual, the common colds, flus, respiratory illness cases. So it's not really alarming to see enterovirus or flu during this time of year, but specifically today we're talking about enterovirus. Enterovirus is very common. There are numerous strains of enterovirus, and all cases of enterovirus identified here in the county are not necessarily going to be D68, and thus won't cause a lot of concern for us here at the health department. What's most important is if someone's ill, to remember to seek medical care, taking their children to the doctor, making sure they get tested so we know really if they have enterovirus or if they have influenza, if they have something like respiratory syncytial virus, which is very common as well at this time of the year. Enterovirus is very common during the summer months to early fall, and so that's not really atypical.
In your opinion, you know, when this happens, what is the protocol with the health department? I mean, kids, they pass things back and forth all the time. But if you hear something like this, the young girl, she's from Polk County, but then it was here in Hillsborough County, what is your protocol at the health department? What do you all do? So for the health department, really what we're trying to identify are cases of D68 or enterovirus where we see clustering or outbreaks of cases more than just one isolated case. One case of D68 is expected. What we don't really want to see is cases in hospital pediatric wards and things like that where we have 4 or 5 cases. That, of course, we're going to investigate thoroughly and make sure that there are special precautions used so that other people throughout the hospital and other staff are not going to be able to transmit it to other folks. So that's really kind of, we look at it of more of a clustering or a outbreak of these cases. Isolated cases we do expect to see, as we've seen throughout the rest of the country. Amanda, thank you so much for being with us. We do appreciate it. She's from the Hillsborough County Health Department. And, you know, we will have plenty more on this with Linda Hurtado. She's going to be back at 5 o'clock on ABC Action News at 5, talking a little bit more about what your child needs to know, what you need to know when your child is headed to school. Thank you so much, Amanda. We do appreciate it.